Now, there has always been an army of lobbyists up on Capitol Hill, and a Bloomberg investigation last month found that the number of lobbyists working on health care reform outnumber lawmakers by 6 to 1. So where do they come from? Well, as Lizzie O'Leary reports from Washington, it appears to be the ultimate revolving door.
Take the 3,300 lobbyists working on health care reform. 2,737 work for industry. Of them, more than half are veterans of Capitol Hill, a federal agency, or the White House. And 55 were once members of Congress, trading hometown constituencies for corporations.
If some former member, former staffer calls a former colleague and says, can I just come up and make a pitch to you for 10 minutes? It's very hard to say no. It's harder much to say no to that person than to you or me or some stranger off the street.
On Capitol Hill, staff members can be equally valuable. Of the 1,200 former staffers lobbying on health care reform, more than half tie back to the 5 key committees now writing the legislation. According to one lawmaker turned lobbyist, access is only part of the advantage.
At the end of the day, I'm only as good as what I've got to say. And so I work very hard to try to get my ducks in a row, to try to understand where the public interest lies in any argument that's being made.
Arguments undeniably influenced, though, by an army fighting on familiar terrain. Lizzie O'Leary, Bloomberg News, Washington.